Hi, and welcome back to our channel. Today, I want to discuss nutrient deficiency dangers caused by stomach acid medications. Now, I am super passionate about helping people resolve their gut issues through natural ways, and also coming to find what is the root cause of why this is happening for you. Now, one very common scenario that I see in practice are individuals who struggle with heartburn or acid reflux or GERD and have gone into their medical practitioner to see, what can I do about this? Oftentimes, they walk away with a prescription for a acid reducer medication. And what they don't know is that if it's taken longer than that 14-day period, it can really cause a lot of issues. Now, before we dig into the rest of the topic, my name is Marcy Vasky, and I am a nutritionist with Fluso Nutrients. At Fluso Nutrients, we pride ourselves on educating you on supplements so that you can make the best choice for yourself, as well as supplying you with supplements that are professional grade quality. Now, of course, we're giving information so that you can make a choice for yourself, but if you have questions, as always, you need to speak with your medical practitioner or a practitioner who is supplement literate to help make sure that you should be taking the supplement you're questioning. So without further ado, let's dig back into our topic of today. Now, you might be asking, well, what is this little pill that I'm talking about? This little pill is a proton pump inhibitor, or otherwise known as just an acid reducer medication. Now, many times people who have, as I mentioned earlier, GERD or maybe a peptic ulcer or acid reflux or heartburn will be prescribed this medication. Now, these medications work by reducing the amount of acid that your stomach produces when you begin digestion, and that helps to reduce symptoms. Now, while they've been shown to be pretty effective in managing symptoms, what is underneath that is the issues that they may cause. Now, before we dig into what issues proton pump inhibitors can create, let's understand what does that stomach acid reducing medication actually do. Now, what these proton pump inhibitors actually do is they work by inhibiting the proton pump in the stomach, which actually produces the acid. And by blocking these pumps, the acid is much reduced and therefore symptoms are also reduced, creating less heartburn or acid reflux. Now, a couple of names for these common medications will be omeprazole or pantoprazole, and you can get them through prescription or even over the counter, such as Prilosec. So now let's dig into some of the fun stuff to understand what kind of deficiencies might happen if you're on a proton pump inhibitor for a long time. Now, stomach acid plays such a crucial role in the digestion of our foods. It helps to digest our proteins, our carbs, our fats, and therefore getting out all of those minerals and vitamins that we need. Now, if our stomach acid is reduced by using a proton pump inhibitor, that means that some of those minerals and vitamins that you're consuming, your body is unable to get. If you've been on a proton pump inhibitor for a prolonged amount of time, you might be experiencing a B12 deficiency. B12 deficiency may feel like neurological problems or dizziness, weakness, fatigue. You may also have a deficiency in calcium, and a deficiency in calcium can show up in osteoporosis or even bone fractures. Another deficiency that is common is an iron deficiency when we've been on proton pump inhibitors for a prolonged period of time. And you might experience fatigue or pale skin or even feeling exhausted. As well, when we have an iron deficiency, we can also have reduced cognitive functions. So brain fog, or just not being able to focus very well. Another key deficiency that can happen over time when taking a proton pump inhibitor will be a deficiency in magnesium. And a deficiency in magnesium can feel like muscle cramping or an irregular heartbeat, shortness of breath, and even a compromised immune system. So if you've been on a proton pump inhibitor for many years, this is when you end up with some of these deficiencies. And these deficiencies are just a few of them, but they're the top ones because they kind of stand out in terms of we need all of that to have a proper functioning body. So if you've been on a proton pump inhibitor and you're kind of wondering, okay, well, what do I do now that I've been on it so long? I can't come off of it. I'll have all those symptoms. And, let's kind of dig into that and talk about what are some options. Some alternative approaches to acid reflux or GERD will be number one, working with a practitioner that can understand and help you make modifications, number one, in your diet. Trying to find those trigger foods that are really triggering to your heartburn or acid reflux, and also just making sure that you're getting a well-rounded diet. In addition to having a well-rounded diet and taking out trigger foods, a lot of times that might look like spicy foods, or many people complain of getting heartburn after they've had a lot of coffee or caffeine, and also trigger foods like sugar. And so working with somebody can be really helpful. Now, of course, there's going to be supplements that can be really helpful in keeping acid reflux and GERD away. And I think part of it is to understand what your triggers are and also go a step deeper into understanding what is the root cause of this. And as we can work from the root cause up, then we can oftentimes mitigate and eliminate heartburn, acid reflux. Now, what I would tell you too, there's a few things. If you are on the proton pump inhibitor and you're just like, I'm not considering any alternative approaches, I would definitely recommend then that you support those key minerals that I discussed above, such as taking a B12 supplement, maybe considering a calcium, a magnesium, and definitely checking your iron to see that if you're anemic or in kind of where that is. If that is something that you find that you're deficient in, then I would recommend, as I said, supplementing with those items. And I'll link those 4 different supplements down below, so you're guaranteed to get a quality supplement if you choose to do so. So in conclusion to all this, I just want to kind of push home that taking medications always have side effects. And definitely medications can be very helpful and are very needed in some instances for sure. However, when it comes to gut health, I think, as I always say, try to understand why you have the issue in the first place. If we can figure that out, we can always help to heal the gut. The body is an amazing thing and loves to heal itself. So if we can support it in any way, that's what we want to do. And also, if you are on a proton pump inhibitor right now and you have those deficiencies such as B12, calcium, iron, or magnesium, please click on the links below to find some professional and quality great supplements. Thanks for joining.